Hi, my name is Dr. John Robinson.
And I'm Dr. Christina Bosch.
We're also known as
the Sex Docs.
Today we want to talk to you about stem cell therapy and what exciting therapy we're doing right now here at the Hormone Zone.
That's right. We're bringing you the future of the medicine now available to you in a very comprehensive and effective fashion.
That's always what we want to do here, bring you something cutting edge, and we always want to do it in a comprehensive fashion. That's exactly what we're thinking is the best approach here at the Hormone Zone. Let's get straight into it. But before we do, we certainly want to remind everyone.
Hi, that's us.
If you hear us in stereo. We want to remind you that you can follow us in a lot of different ways. Aside from online, you can follow us in a couple different magazines.
Arizona Foothills and So Scottsdale, we have contributing articles to both of those magazines on a regular basis.
Yeah, in fact, here recently with So Scottsdale, we were featured as the 2019 People to
Watch.
People to Watch, that's right.
In the Valley.
Yeah. So part of the reason I'm bringing this up is to mention also the Cellular Medicine Association. Mm-hmm. So we're also members of the CMA, and this is a particular organization that is part of the training and the cutting edge nature of stem cell and all things related to the growth factors and different things that we're using with platelet-rich plasma, O-shot, P-shot, and now this stem cell IV therapy that we're going to talk about today.
So the benefit of us belonging to associations like this and why we like to inform you of that is because we want to always remind you that we are taking in the breadth of knowledge of a large body of physicians and bringing it to you in your own personal physician.
That's a great point. Let's get straight into it. What are these stem cells? Adult mesenchymal stem cells. Stem cells are coming straight from the umbilical cord, you can see here, and they're actually adult stem cells. It's important to make sure we're talking about the different nature of stem cells versus embryonic stem cells, and that's something out there that maybe you've heard about. It's a little controversial. That's not at all what we're talking about here. The technology has changed to the point where we can actually get the stem cells straight from the umbilical cord. These are donated placentas.
Right.
Mom and baby are happy. There's no problems with that,
right.
And the mother willingly donates this placenta, and then they screen it. It's a highly screened process, and then they can derive and manufacture these stem cells.
Right, so in a nutshell, to very quickly address the two most controversial concerns would be, number one, that this is volunteer donation, and number two is that these are very clean, very tested samples of donation.
Yeah, it comes from a tissue bank, and it's extremely difficult to pass muster with that based on how they're screening it, and it's very complicated and good for everyone involved. And then once it actually goes to the manufacturer, it's further screened again. So we're of course using one of the best sources for mesenchymal stem cells. Now, what is it? How does it work? What is it going to do for you, and how does it work?
What is it not doing for you? I mean, you've heard us use the expression quite a bit of age management or anti-aging, but again, age management. These are the tools that we believe are very user-friendly and incredibly effective for helping to reduce any of the burdens or the anti-inflammatory benefits that keep, yeah, he says it all the time. The anti-inflammatory benefits that help us, yes, go through chronological aging. The years are passing, but we're doing it quite gracefully.
It's true, and I say about the anti-inflammatory, it's because she's right. Everything comes down to inflammation with disease, and that's certainly one of the main things that we're seeing in the research that stem cells are really able to help with, and one of the big reasons it helps with a lot of the different diseases that it's working with, and we'll talk about that in a second. It's working on reducing inflammation.
Yeah.
It's also doing something, improving autophagy, which that just means is cellular kind of cleanup. This is part of one of the benefits you get from fasting. When you fast, the body kind of goes in and cleans itself up. Well, you're getting that from stem cell therapy also.
And then the other thing that we love about it is this notion of direct healing. So this is a targeted approach to say, where do I have damage? And then through the wisdom of the process, you get healing in that particular area.
That's a great point. Here's what stem cells do. They home right in to where the areas of injury are already present. You have stem cells in your body right now. If you get injured, you cut your hand, then stem cells in an orchestrated fashion go towards that area and create healing and orchestrate the healing process. When you reintroduce stem cells in this particular way that we're talking about, it's going to go kind of where it needs to go, and that's the exciting thing with it. There's some other nuances with that we're doing from a therapeutic standpoint, but for the most part, it's got direct healing.
Yeah.
Now, what does it do? What's it going to do for you?
Well, I always focus on the beautification. For me, I think anything that has to do mental and emotional wellness and cognitive restoration, as well as the beautification. I feel like for me, and I'm predominantly working with females, that those are the categories of our life that are most valuable to us. We want to make sure we feel beautiful on the outside, and we want to make sure that we feel useful to ourselves and to our family. So when you're using stem cell and you're getting that age management benefit, you're helping to prevent inflammatory conditions like the Parkinson's, dementia, other cognitive decay,
yes,
neurological
right.
issues. And then from a cosmetic perspective, you can use it as a booster for these vampire facelifts and facials that give you that collagen and elastin repair, and you're still you. You don't look like someone else. You're just beautified and aging, again, more gracefully.
Noticeably natural.
Noticeably natural.
That's a good point, and to remind everyone too, we do the vampire facial and the vampire facelift. It's important to maybe segue into that so you understand that's part of the cellular medicine.
Right.
It's using platelet-rich plasma. There's some other videos that we've certainly done talking about that. But what we're doing now with stem cell therapy is enhancing your own natural platelet-rich plasma with this stem cell, and whether we're talking about injecting in the face or helping with the O shot, the orgasm shot, or the P shot, the Priapus shot, and also adding in stem cell with that and enhancing the results. And we have seen that I think we're getting a little bit better results.
Absolutely. I mean, you get good results with those procedures on their own, obviously. But when you amplify the benefits, so how would you decide if you're someone who's wanting to do that? Well, one of the reasons why people will come in is because they say, I just want to practice prevention, which I think is huge. It is much more difficult to repair a damaged system than it is to help keep it working well. So just like you do tune-ups for your cars, these stem cell in the form of, let's say, an IV is going to be a powerhouse tool to help prevent those conditions in the first place.
And that's a good segue about the IV. Before we do, right here at the bottom of the slide, you can see about age management. That's something that Dr. Bosch was already talking about. We believe it's important to manage the aging process, and that's exactly what we're starting to see that stem cell can do, is actually helping with the aging process. Now, there's a relatively recent study that's going on, and this is still ongoing. It was first published here in Gerontology in July of 2017, where they're using stem cells in what's called frailty, which is kind of a fancy word to just saying for the process of aging. And what they're able to do is go with a certain dose, and we understand what this dose is, of going in and being able to administer these stem cells to help with the conditions that relate to aging. Those conditions were what we just saw on the other slide about inflammation and the different diseases that are related to that.
Sexual wellness.
Yes, all the above. So we're able to administer this in a very specific way to be able to help with this, and it's basically what they're talking about here with this particular study. So IV therapy. It's really simple,
It's
right?
really simple, yeah. And it's good for us to tell you that. It's really simple, not just because it helps take away some of those initial fears of one more medical procedure, but also because I think people have a conception that stem cell is very specific to, I damaged a joint, or my knee is no longer working, or something that many people out there who are, the working well will say, I don't need that. But here's the thing, we can all benefit from a little bit more sunshine, a little bit more time at the beach, and a little bit more stem cells. So when you do your IVs, you can approach it as this is for my general health, and doing an IV every 3 to 6 months and then reassessing is a great approach.
I agree. Wow, it's just like getting a little bit more sun and coming and getting your IV. I don't know if we can do anything about the sun, but certainly coming in every 3 to 6 months is roughly what we're seeing. In some cases, back to that study, once they did the stem cell, they saw results up to 18 months later. And again, that's a very much ongoing study, and it's out of the University of Miami, and they're still looking at results ongoing with that. So it's very exciting stuff. Again, very simple. The IV takes, I don't know, maybe 15 minutes to administer. Very simple
It's a typical
to do.
push.
Now, what's extremely important about what we do here at the Hormone Zone, it's comprehensive care and it's results driven.
It's measurable as well. We have said on almost every video that you get to watch from us that the patient's feedback is probably the most important tool that we have. When you're having an ailment, you want to know it got better, and you want to know that the patient appreciates that. Yes. But what about when you're practicing prevention? When you're practicing prevention, there's no real symptom relief. So we have other tools that we can utilize.
Well, we're certainly going to look at lab work, and there are certain things that you can look at to be able to determine whether or not even the stem cell is doing its thing over time. So we're measuring things, we're making sure we're really getting as scientific as possible about it. We always come back to the subjectivity and how the patient is feeling, but there are ways to measure it. So what's get measured gets accomplished, and we make sure we look at that here. But we're also looking at an extreme comprehensive approach. if we're going to do stem cell, we're also going to look at hormone replacement therapy and the other things that we're already doing here at the hormone zone.
We always stay the hormone zone.
The hormone zone.
Not
So-
the twilight zone.
It sometimes
Probably
can
should
be
have
the
said
twilight zone.
that.
We'll keep you out of the twilight zone.
Yes,
we'll
we'll keep you in the
hormone
hormone zone. Goodness.
Well, what we would definitely want you to do is contact us if you have any questions. We can certainly amplify all of this for you in terms of answering those questions, get you to understand it a little bit more with some detail. The staff is here for you. We're here for you. My name's Dr. John Robinson.
And I'm Dr. Christina Bosch,
And we are.
the Sex Docs.
And today we were talking about stem cell. Come and see us about the stem cell. We'll see you next time.